I'm an osteopath, and me and my husband, who is a chiropractor, we've got a boutique clinic, and we specialize in spine decompression and joint regeneration. So I've been using Shockwave for about a year and a half now. So that's the reason why I'm here, just to learn more about Shockwave. Yeah, so we have the radial and the focal unit from stores. So actually we came across to you when we were looking and purchasing a Shockwave, and that's how chatting with you help us to decide what you need to get and how for the needs that we had at the time, or for our clinic, what kind of Shockwave was probably the best fit for us.
Yeah.
That's how we started having your online training. And then I was just begging you, when are you going to do an on live seminar or anything, just to, obviously, because you always feel that there's probably something missing, right, on the online course, even though it's very well structured and you see all the videos and you can follow it very easily. There's always that need of finding a few tricks and how do you do this, or when you start experiencing with patients, there are obviously things that they come along that I'd be surprised and think, okay, so how can I sort out this problem? How much pressure I'm using, or how am I using the hand pace? Am I going a bit too fast here? Or am I going too slow? Or, it's all these little things that sometimes just with online you don't really realize, or you don't pay that much attention.
Yeah.
For me, it's even just reading the online courses I was telling you before. Sometimes even if you read it, you think you understand it and you think you're doing right, but then you're like, oh, okay, so I can do it this way instead, right? So there's a lot of little bits that once you get together and you practice it more and you show, okay, so this is how I do a shoulder, this is how I do a hip, then it's like, okay, so then I was missing this part, or I was going a bit too fast here, or so the idea is that you refine your technique, right? And that's the main idea of this course for me, was just refining, and so then you can be more precise and more effective, and you can shorten the time that the patient is there, so they're happy with that.
So I have actually a question specifically about the courses. I know you've taken so many courses, and everybody who's teaching Shockwave, it's amazing, and they're contributing to proper Shockwave application. Is like, what do you find with our courses or protocols? Like, how would that, like, is that different than?
Well, I think one of the main things, the main thing is that you are the only one that have found that teaches focal.
Yeah.
Right? And the other ones have done courses where they teach radial, and so obviously people that they only use radial, the approach is slightly different, how they use the hand is slightly different. So obviously you always get bits, right?
Yeah.
So you were the only one who was doing the focal. I've seen in other, we've seen each other as well in conferences and stuff, that they go through different treatments, but they never really teach it. It's just only like mentioning, okay, or very little. You get like a very little exposure of how they physically do it. There's a lot of research behind, but not like hands-on. On focal. So that was the primary reason why I wanted to do more hands-on focal, and kind of knowing more about what else can I do with this technique, right? How there's surely probably other ways that I can use, and definitely now realize that there are other ways to use in certain conditions or certain tissues that you find that there is that be more challenging. It's like, okay, so I can do it this way now.
Yeah. So do you find okay, there's two questions.
Right.
Here. So
I miss one.
First one is like, why did you decide to take the training? Because we know Shockwave is not regulated. Many practitioners just go and use the device with like zero training. And then second thing, and I know that you probably did not really experience that because you took the training right away, But do you find that shockwave is very painful, like same as, you know, when your clients come in that they were treated elsewhere and they say it's like it hurts a lot or it's unbearable?
Yeah, it's like they more than because I haven't really had that many people that had shockwave before.
Okay.
I probably have had a couple of people that have had shockwave done before. So, you know, yeah, and they mentioned that was very painful and stuff, but I think it was more because as I started using it, it's like I found that basically I really enjoy doing it, and I thought, well, I want to be as best as I can be.
Yeah.
Right. So then when you enjoy doing something, it's like, okay, so where can I go that they teach me more? So that's why, you know, I'm here now. So I keep kind of going, who else can teach me more?
Yeah.
Right. So that's what
so my last question, so the investment that you put on the training, on the course, was it worth it?
Oh, definitely. Yes. Yeah. From day one.
Yeah. Yes. Yeah. That's amazing. So I hope we can convince another practitioner wherever they are, and if they're in the fence of like, do I get the training? Do I invest in the training? What do I do?
Well, yeah, definitely, because I have actually, one of the thing is one person that came, because as I said, I had only like 2 people that they have had shockwave done before. One person that came and mentioned that they had that before done, and then they said, oh, you know, they just put it here where it hurts, or and they said that it wasn't really worth it doing it anyways because it wasn't going to change the issue I've got, right? So you find that you know that people there that they use it as saying, okay, where's the pain here? I just put the hand piece there and that's it. Or those that they say, well, it's not worth it doing it on you because it's not gonna change your issue. So, you know, it's like, well, that was shocking.
Yes, yeah. We make sure like all our training is based on treating the dysfunction while we stimulate regeneration and treating as much as possible.
Yeah. So then when they see you that you go like to different places, they go like, oh, why are you doing that? Why are you going there? If you know. Yeah. And it's okay. So you know you have to do not just an spot, right? You have to do other areas as well. Yeah, but it was right.
Okay, Isabel. So thank you very much for your time. And
you're very, very welcome. Thank you for having me.
Yeah. Awesome. Thank you.